So, a lot of things that I liked about physical therapy when I first started were just being able to help people, just seeing them get stronger and get better and really get confidence. And that's what I still love about it. Really, and seeing them just light up, knowing that they're getting better. And let's see, some of the struggles would be probably some of the paperwork, documenting everything I did. Took me a while to kind of learn how to get comfortable and not take an hour documenting the treatment that I did, and so that was kind of hard, some of those logistics. There's always people who don't want to do their physical therapy. There's always people who are in a lot of pain, and it's really difficult to do the physical therapy. So learning to work with those folks and work around those barriers, and that was definitely, there's been some struggles, and I think also educating someone who's much older than me and having the confidence to say, I know what I'm talking about. If you do these things, you're going to get better. And, at times they, look at me. I'm 4'10", and they're looking down at me like, you're going to help me, and you're half my age or a quarter of my age, and you're going to tell me what is good for me. It's like, yes, that's exactly what's going to happen here. So yeah, definitely gaining confidence in what I was doing and how to talk with people was a challenge that I had to work through quite a bit, especially early on.
So I heard you talking about a lot of paperwork. Do you still do the SOAP notes?
Yes, for the most part. More in depth now. So we'll use a computer program that gives specifics of exactly what they want as the company, and they have to guide us into documenting correctly to get reimbursement from insurance companies, Medicare, and all that. So it's just it's part of healthcare. You have to be able to document in a way that's going to be reimbursed, that reflects the skills that you provided. So yeah, it's definitely something to take into account for working in any healthcare job.
Do you because is there a good work environment where you live? Do you have not where you live, where you work? Do you have rapport with your colleagues? Do you talk to them a lot?
Yeah, I do. So I currently am working in home health, and all of our interaction, well, almost all of it, is over the phone or in Zoom meetings. And this current job that I have, I feel like I do have good rapport because I don't feel like I have to be. I'm not managed as much. We talk as almost as equals, me and the physical therapist that I work with. It's just it's a team, and it does feel pretty equal. So yeah, I feel like I have a pretty good rapport. I feel like if I wasn't as knowledgeable or responsible, granted I'm 11 years into this career, maybe I would have to be managed more, but yeah, I feel like I'm at a good point in my career where I know what I'm doing and I can work well with others, and I really like the company I work for right now. I do also work on call for the company that I worked for many years, or 9 years before this company, and we still have a good rapport as well, and I can they can call me and know that I'm going to be able to work with any patient and have a good outcome. And if they're needing extra help, it's kind of nice to be able to work a little extra in the same skilled nursing setting that I used to work in as well. So it's nice to be able to have the flexibility to do different areas of physical therapy still, and yeah, still keep those connections and keep rapport with old colleagues, new colleagues, yeah, different settings.
I heard you say company. Can you explain that more to me?
Yeah, so for as for the home health company, they are a private company that hires therapists, physical therapists, assistants, speech therapists, occupational, and they also have nursing. And so they hire this home health staff to provide services for patients, and they bill the insurance or Medicare for the services that we provide. So it is a company, they get a cut, they pay us. Yeah, so we're kind of contract workers, I suppose, in a way. And then uh, as for skilled nursing, it's kind of the same deal. So instead of going home to home, though, it's a facility, and the company owns the facility and provides the nursing, the healthcare, the therapy, and but yes, they are private companies. Some are nonprofit, some are for profit, um, but yeah, they are companies. They do get paid through insurance or Medicare. So yeah, that's how our healthcare works. So
Can I ask about your old company? Did you work for like the government or like something like Kaiser?
um, so it was a private company, and it was not nonprofit. So they were for profit. Um, they 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 do. I mean, Medicare is government, so the government is paying them. So so the government is involved as far as Medicare goes, but no, not owned by the government or anything. So I think the VA, the veterans homes or the veterans system, they are government owned or government operated, and they will hire their own therapists in some of those scenarios. Private companies can also provide services for vets, but there can be separate facilities and services for vets that the government provides.
Can I ask how, like, for profit and for nonprofit? Can I ask like which one do you like more and why you like the other one more?
Yeah, I feel like each company is different, and I when I've looked at companies, I've you have to balance, their values and their the way the company works, whether they're a profit or nonprofit. And honestly, you have to take care of yourself. I have kids to take care of, and you know, I compared several different companies, trying to decide which one to work for. In my case, I did choose a for-profit. They still had good values. They still took very good care of their patients. So yeah, I mean, I can see, I definitely support nonprofits. They're great institutions. Just comparing though for myself, and just the overall who I wanted to work for, it just turned out that, honestly, the best job offers were just happened to be companies that were for profit, still had good values. I just decided to go with that.
Because it would gave you more free time and probably the pay was better.
Yeah, there's a lot of competition out there in healthcare. You can kind of choose in a lot of scenarios, what you want to do, where you want to work, and how you want to work. And so it's nice. You definitely have to. There's a lot of comparing to do though. Yeah.
One last question.
Mm-hmm.
What future, to anyone wanting to go into your field, what future advice do you have?
Advice for anyone going into healthcare in general, or physical therapy?
Physical therapy.
Physical therapy. I would say, you have so many opportunities in front of you. Don't limit yourself to just one specialty. I mean, I definitely have a specialty, but I've kept doors open with other areas too. I mean, there's outpatient, there's inpatient, hospital, acute care. There's so many different areas of physical therapy, neuro. There's so many different areas, and that's not something that everybody gets to experience. But with this career, you really can, and really learn a lot, and keep your doors open, and have your main job, but have a side gig and keep learning. Like, it's been really interesting just to be able to keep doors open, to learn new things, and be in different areas of rehab. And just feel like I've learned a lot, and just really appreciate the lifelong learning of it too.
Thank you so much for letting me interview you.
Yeah, of course. Thank you. Bye.
Bye.